Globally, around 38 million people are living with HIV. Since the virus was identified in 1984, more than 36 million people have died of HIV or AIDS-related illnesses. Each year on December 1st, World AIDS Day, many reflect on the fight against one of history's most destructive pandemics.
The state of affairs globally is very much a situation of the haves and the have-nots. For those people who live in places where treatment is not free, or in situations where the treatments are still very old, treatments with lots of side effects, people don't do so well. And without treatment, HIV remains a disease that people die of.
Experts say that effective treatment prevents HIV-infected people from transmitting the virus. They also say that worldwide, more than 50% of those living with HIV are women, and that 1.3 million women with HIV will become pregnant. Effective treatment can prevent transmission of the virus to the unborn child. Britain's Dr. Orkin led a global effort to develop the first long-acting HIV treatment. She says that treatments such as injectables taken once every 2 months are available.
But where I live, it could amount to 6 treatment days a year for someone with HIV. And that's very different from having to take treatment 365 days a year. So it's a real breakthrough.
U.S. researchers are chasing a cure by studying HIV patients whose immune systems fight HIV without medication.
Some people are able to keep HIV in check with their own immune systems, and that really set us off in the direction of trying to understand how that was possible.
Laurel Willenberg is one such patient. She was diagnosed as HIV positive in 1992, but has never been symptomatic.
29 and a half years, I have never needed to take HIV medications. I'm humbled. I'm grateful.
Dr. Walker and his colleagues at the Reagan Institute do think it will be possible to one day cure those infected with HIV.
Our goal is to train their immune system to develop this kind of super function that we see in some rare individuals to actually be able to ideally cure them of their HIV infection, or at the very least be able to keep the virus so under control that it can't cause any disease in the person and that it can't be transmitted to somebody else.
But World AIDS Day reminds us that HIV hasn't gone away. With funding and attention now focused on the COVID-19 pandemic, testing for HIV is down and trials have been disrupted. Developments that are worrying HIV specialists and those with the disease. Laurel, Bowman, VOA News, Washington.